The basis of what we need to know as personal trainers or fitness instructors is how your body is formed, what it does and how it does it. Once we have understood that, we can then go through how to adapt that in what our client wants to achieve. So if we look at the structural part of our body and we break it down into systems, we have your skeletal system, your muscular system, your circulatory system, your aerobic cardiovascular system, your nervous system, and your digestive system. So if we look and focus on our skeletal system, it consists of 206 bones. Those bones are then attached together through ligaments, and then our muscles are then attached to those bones through tendons. And what covers to protect each of those joints is cartilage. The functions of our skeleton, in terms of what's inside the core, is it allows muscle attachment and movement points. It stores minerals within the bones, calcium and various other vitamins, vitamin B, vitamin D. It protects your vital organs in terms of the trunk of your body. It creates your shape. Everyone's shape is different because all your bones are different lengths. And it creates and produces cells. Now, if we look at our human body and each individual person on the planet, everyone's different. Now, we look at how they're different by what they're made of. Everyone's got a skeletal system, everyone's got muscle, and everyone's got organs. But what forms different people is how those different parts have developed over time. So the height you are is probably determined by the length of the muscles, usually either the femur or the spinal cord in terms of how tall you're going to grow. The size and width generally due to the muscle size and depth of those muscles to create a form. And your organs are then going to fill out the inner core of what your body needs to circulate blood for you to be healthy. So when we think about our bodies being different, we want to look at what's called somatotypes. Now, somatotypes is how we categorize the different body forms. And we look at ectomorph as one, which is a slim, skinny, tall person. A mesomorph, which is a muscular person that's quite defined, lower body fat percentages. An endomorph being the larger fat percentage of body and quite short and stubby. Okay, you can actually combine those because sometimes you get different forms of people as you get older, depending on diets and health. You can form ectomorph people, which are tall and slim, but then a part of their body is going to be built up of adipose tissue, like a male stomach from too much alcohol consumption over time. So your body can categorize in different ways. If we move to the shape and how we divide our skeleton as human beings, we want to focus on your axial skeleton and your appendicular skeleton. So your axial skeleton is created of 80 bones altogether, and it's going to be the skull and anything that is your trunk. So your rib cage, your spine, all the way down to your coccyx. So that's clavicular, ribs, all of them, spine from neck, head, all the way down. Your appendicular is what's your limbs, and they're going to be built up of 126 bones altogether, from your pelvis to your legs, your toes, your hands, and your arms and shoulders. If we break down that axial skeleton and we look at our vertebral column, our spine, that's also broken down into various different segments. So if we start from the top and we work our way down, we have 33 individual bones altogether. The top part is your cervical vertebrae. Now there's 7 of those. After you've got to the last bone within your cervical vertebrae, numbered C1, C2, all the way to C7, you start your thoracic vertebrae, which is made of 12 bones. And that's exactly the same. It's called T1, T2, all the way down to T12. Once you finish that, the next section is your lumbar spine, your lumbar part of your vertebrae, and that's made up of 5. And as you can guess, it'll be L1 to L5. After that is your sacral, and then your coccyx or your coccygeals, okay? And they're both made up of 5 and then 4, which form your tailbone at the end. If we look at the spine and the way it moves, it's bones connected together with cartilage to allow that movement within it, okay? What's really important about our vertebrae is that the nervous system and the nerves run through that spine, okay? So if we think about how we become injured severely, we look at if you break certain bones, it can snap spines. It can snap the nerves within the spine. So if we think about how people become paraplegic or things like that and lose the use of their arms, it's usually because they've broken something from their thoracic, the top thoracics, anything down doesn't work. So if you break a lumbar spine and you tear a nerve system through there, anything from that part down is then not going to work either. If we think about how our spine is formed, we can have different issues with it. So this can be through when you're born and how you're born, to creating it through your lifestyle. And what's caused a lower bend within your spine is called lordosis. And we can think about that within the D shape within the word is what happens to your spine at the bottom of your spine. The lower end pushes forward, so you then have almost an issue with your internal organs from that area. Another issue could be kyphosis, which is the bend, the same almost bend, but through the top part of your spine. And what's going to happen is from your shoulder, almost the cervical top thoracic spine is going to push forward, which is going to cause a curve within the top part of your spine, which is almost a hunchback. And then the last one is scoliosis, which is quite severe, and it becomes an S form within the side of your spine, which can cause a lot of issues with mobility and the structure and movement of how you can to live. Scoliosis is usually made and people recover from it through surgery. If we then look at how our bones are then formed or classified, we break them down into little groups. Now we have what's called a long bone. Anything from your humerus or your femur can be classed as a long bone due to its length. We have short bones, which can be called your metatarsals, which are within your fingers, or your carpals within your toes. Irregular bones, which form your spine. Flat bones, which are flat, considering maybe our scapula within the backs of our shoulders. A lot of the anatomy of the body you can actually look at and get a clear picture of what it is from its name. So a flat bone generally is flat. There's not a lot of discrepancies in the names of things in terms of the same as muscles. Muscles are usually named what they are because they attach to a certain bone and they're either inferior or anterior depending on where they actually are in the body. So if we look at the classifications of the bones that we have, they're all different shapes and sizes. They are all in different locations. So the first one, if you look at, is a long bone. So a long bone, with its name, is one of the longest. So anything from the humerus to the femur is classed as a long bone. Short bones, we can think about our metatarsals in terms of our skeleton's fingers. Very short bones that forms different amounts, which allows the movement at those joints. And then we have irregular bones in terms of the vertebrae. They're odd in shape, they don't look natural, they're not like the long or the short bones in what they look like. And then our last one is a flat bone, which we can see on the scapula, which on the back is flat as a shape. So if we look at, we've gone through the structure of our skeleton. Now if we think about how it's formed, all our bones are living organisms, so they need a blood supply. So when they're in the natural growing in terms of what they would be when you're a baby and they grow and they form and you grow into an adult where you stop growing, they need that blood supply to be able to develop, just as your muscles would. Okay? So bones at birth are mainly cartilage. So the skeleton matures with calcium and magnesium deposits over time, and that then forms a structure called osteoblasts, which is the building of bone cells. This process of bone growth is called ossification, and that forms the structure and the hardness of a bone itself. Okay, ossification is completed by the age of about 25 years old, and that can be a variety of different reasons why it can be longer or shorter of your age, the training you go through. That's why we recommend that anyone under the age of 16 probably not use any form of weight training, because it's going to then stunt the growth through the scientific research. It says it stunts growth of the bone formation in terms of ossification, but anyone above the age of 16, it's gone through that process long enough so it doesn't have a hindering factor on that bone growth in terms of ossification. Okay, so if we break down the structure of the bones in terms of the classification of them, and we focus on a long bone, as an example, we're going to use the humerus as a long bone itself. It's broken down into different sorts and types of bone. So a compact bone is the shaft of it, it's the hardest point of that bone. The spongy bone is the cancellous bone, which is the end points, which actually secures themselves in the sockets. And then the red marrow is within the inner section of the bone, which is formed of red and white blood cells. So if you look at what's around the bone itself, is what's called a periosteum, and that's the fibrous sheath that covers the bone itself as a protective layer. Factors affecting bone growth can be things like osteoporosis. What osteoporosis is where bones become thinner and more fragile. The older you get, the thinner and more brittle and fragile your bones become. And that is probably due to the age and the growth of that, how much stimuli in terms of the environment that your body's been put through over time, the nutrients that you've put yourself in terms of everyone's gone through periods of time where they've either been malnourished within certain nutrient deficiencies. So we need to look at that as we get older. Any weight-bearing exercise is effective as encouraging an increase in bone density, as what it does, it creates those osteoblasts. It breaks down those cells within the bones to then form stronger bones. So it's similar to a muscle where it breaks tears the fibers, and then your body recovers them to be bigger. It's an adaptation that your body goes through. So within the lifespan of your life, what we find is when we're younger, we're quite small, and our bones get larger, and then we get a lot taller. And as we get older, those bones actually then become smaller in size as they get thinner and more fragile. So you actually then shrink in size as you get older. Okay, so moving on from the structure of the skeleton, we're going to go into the joints. Now, joints are where bones meet together. And we have three classifications of joints. We have immovable, slightly movable, and freely movable. So immovable are those that are formed together by fibrous connective tissue, such as your skull. They are different sections of bone forged together and fused so they can't move. Slightly movable, things like the thoracic vertebrae, which allow a certain amount of movement in terms of twisting, tilting slightly, but then they don't rotate and move that full rotation. And then freely movable, we have our shoulders, our knees and our elbows, and other joints which are called synovial joints. So anything that is at a point where you can allow movement, like our wrists and our ankles, is called a synovial joint, which we're going to cover in a lot more depth, because those are the joints that allows contractions and extensions of muscles to form those movements in terms of the gym or training, however you like to do. Now, if we go into further depths about the structure of the synovial joints, we want to figure out what it's made of. So within that joint structure, we have articular cartilage. Now, articular cartilage lines the ends of the bone for smooth movement. So it allows the bones not to then grate on each other, causing further pain and injury. Additionally, that articular cartilage acts as the body's first shock absorber. So if you're landing from a jump or a box jump and you get your knees in terms of catching yourself, the shock absorption through that articular cartilage is going to take majority of the impact. The joint capsule. So if we look at our skeleton and we have the end of the humerus and it goes into that shoulder girdle, the capsule is within the shoulder girdle, taking the humerus within it. Synovial joint membrane is the synovial fluid in terms of how that then covers the joint itself to almost allow lubrication from the fluid itself. And then we have the last two, which is ligaments and tendons. So the ligaments allow the bone to then attach to that shoulder girdle in terms of the bone to bone, and then the tendon is the muscle. So if we have the tricep is attached to the shoulder girdle to allow the contraction, whether it's extension or flexion at that range of the movement. So if we look at the different synovial joints within the body, there are a couple. First one we're going to focus on is gliding joints. So the reference point we're going to use on our skeleton is the hand. So the palm of the hand, not the fingers, the palm of the hand just before you get to the fingers is a gliding joint. Now that allows the movement in terms of that slight flexion of your wrists. Okay, our next synovial joint that we're going to focus on is our hinge joint. So on our skeleton, we're going to use the elbow as our reference point. So the elbow is a hinge joint. It only allows movement up and down, no rotation or side to side, just that up and down flexion extension within the range of that joint. Another one would be your knee. It's the same movement, just at the lower extremities. So our next synovial joint we're going to focus on is a pivot joint. So the pivot joint is located within the neck. So if we use our skeleton here to demonstrate, it's going to allow movement in terms of rotation and up and down in terms of what he's allowed to do, nodding side to side, up and down. The thing to note about the pivot joint is it doesn't allow that full rotation. There's ligaments and muscles that prevent that full rotation of his head coming all the way around, which can cause fatal death or a lot of injuries. So the next synovial joint that we're going to focus on is ball and socket joint. So we have two main areas that we're going to focus on, one being the pelvic girdle and one being the shoulder girdle. So the pelvic girdle is your femur being located into your pelvis to allow your leg to move and rotate at that angle. And the one we're going to focus on at the moment is our shoulder girdle. So with our skeleton, our shoulder, in terms of our humerus, the end point, is located and pushed into that shoulder girdle. That allows rotation, abduction, adduction, in terms of what range of movement that's going to allow. The next synovial joint that we're going to use and talk about is the saddle joint. So a saddle joint that we're going to focus on is our hand and our thumb. So on the skeleton, it's not the metacarpals, it's the carpal within this bone here, because this is going to allow that bone to rotate and be on a saddle area, so it's not going to move anymore. And the last synovial joint that we're going to look at is the condyloid joint. Okay, and we can find that in two areas, the feet and the hands. Again, we have the metacarpal and metatarsals, depending on which one you go for. And now we focus on the condyloid being that metatarsal that allows that movement at that finger. What we notice about the condyloids in terms of the fingers, you can't bend them back, you can bend them in. Okay, moving on through our joints, we have movements and range of movement within joints to allow exercises and actions with our joints and our bones and our muscles. So if we look at analysing those joint actions, we want to first pinpoint the anatomical position that we actually look at. So at the moment with our skeleton, we're looking at the anterior portion, and later we're going to look through the posterior portion, which will be his back. At the moment, what we're going to demonstrate is flexion and extension. So flexion and extension are almost the opposite of each other. You don't get one without the other. So if we look at our skeleton here, flexion and extension at the elbow would allow the bicep muscle to contract, to cause flexion, and then our tricep muscle to cause extension, which is getting longer, which is the complete opposite of this. These two muscles are an antagonistic pair. Okay, so they work hand in hand together, a lot like a lot of the muscles in terms of opposites. They will work together to form that movement. So anything from a bicep curl or just moving the weight to allow your arm to bend causes that flexion extension at that elbow. Now, you can get flexion extension at the knee, you can get a flexion extension at different muscles to allow different exercises to occur. So another variety of flexion extension is we're going to think about our core body. So flexion extension within our core allows the movement of a side-to-side rotation, but that is, in terms of the anatomical way of it, is your core muscles, your rectus abdominis, contracting to allow the flexion and extension. One flexes and gets shorter, one side gets longer in extension. Moving through our joint actions, we look at abduction and adduction. And if we look at the names of these, abduction is getting abducted, getting taken away. So the movement of you going further away from the body. So if we use the shoulder joint again, abduction at the shoulder is where the deltoid is going to get shorter and it's going to get abducted away to go further away. Adduction is the opposite to that, and you're adding it towards your body, bringing that muscle back where the muscle then gets longer. So abduction, muscle shorter, movement further away from you. Adduction, muscle lengthened, the arm comes back towards your body. That's the same as the legs and the hips in terms of you moving side to side in that same exact plane. Moving to our next joint action, we have rotation. So same with our abduction, adduction in our shoulder. We can have rotation at that shoulder because the ball and socket joint allows that movement. Alternative to that, our spine and our vertebrae allows rotation at the hips, through the spine at different parts, and that's a contraction to allow that movement at different areas. So what we'll have, our rectus abdominis and certain areas of our back, so like a rectus spinae, moving further up, depending on which one is going to contract together as agonistic pairs, is going to allow that movement for you to turn around, and that's called rotation. Our next one is circumduction. So circumduction is that movement around the arm to allow your palms to go up, palms to come down, but that movement is the rotation of your elbow and your shoulder working together. Our last one that we look at in terms of our shoulder area is elevation and depression. So the word elevation is another word for moving up. So elevation for an elevator, if I shrug, if I contract my traps, I'm going to bring my shoulders up, my clavicle are going to move up, and that's elevating my clavicle. Depression is coming down, back to its normal position. If I can, in my natural form, I can depress my shoulders slightly and it will bring my collarbone down to the floor. And then lateral flexion. So we think about the wording. Lateral is to the side. Flexion, shortening of a muscle. Extension, lengthening of a muscle. So if I go laterally, I'm going to bend to the side. My obliques are going to contract and get shorter. My other external obliques are going to lengthen and get longer, causing extension and flexion laterally. Pronation and supination. So we come back to our palm. Pronation is palm facing down. Supination, palm facing up. And it's just that change of form to allow that movement. And if we think about the movement and do it, what muscles are contracting to allow that to do it? I can feel my triceps engaging, my biceps engaging when I go back to this supination and pronation. Okay, so our last movement is protraction and retraction. And I'm going to demonstrate this using my shoulders. So protraction is bringing my shoulders forward. So if on a side view, I'm going to bring my shoulders and it's almost like I'm rounding, bringing my chest contracting that chest and extending, lengthening my scapula, my delts. The opposite to that is retraction. So if I wanted to retract, I would then retract my scapula, my shoulder blades back, bringing my shoulder blades back. What that does is it lengthens that pectoral muscle, engaging it in the most lengthened position. And that's going to allow you to then bench press with a better form, contract as much muscle as possible from its lengthened range to its shortened range when you go through either a dumbbell press or a dumbbell fly or a bench press or any movement that's going to incorporate your pecs. So if you look at plantar flexion and dorsiflexion, and what that is to do with the feet. Okay, so if we think about dorsiflexion, like a dorsifin of a dolphin, it's going to be pointing upwards. So the foot is then pointing upwards. That is extending the Achilles tendon as long as it can. And then plantar flexion, if we think about the wording, plant, if you plant your foot, you're pointing it towards the floor. So they work together as opposites. And we can see this movement most frequently when we run and our feet contact the floor in a plantar way, and then we bring our foot off and it comes into a dorsiflexion. That's going to use simultaneously gastrocnemius and your tibius anterior.